Okay. So the next topic that I'll be going to discuss is all about caring of mothers and pediatric patients, geriatrics, and post uh what's this? Caring for those patients who are dead. Okay, so let's start with since the conception, from conception to death. So we need to discuss the antepartum period or the prenatal period. So prenatal care, okay, during prenatal care, during conception, during pregnancy of the mother, okay, what are the things that we need to educate them as nursing assistant? First is we need to educate them about proper nutrition, healthy diet, okay? So the OB-gynecologist or the doctor for pregnant mothers, they're the one giving what's the right diet for them. But we are only, as nursing assistants, we are only reinforcing them to follow the diet, okay? Especially for those pregnant mothers who is very uh, malnourished, okay, it will affect the baby later on. So we need to educate them. We need to reinforce them. Then avoidance of toxins, okay? As we know, as the mother, if you are pregnant, okay, you are very at risk of having infections, okay, acquiring any diseases. So you should instruct them to take care and very careful in dealing with someone, dealing with things, because it can affect uh, their pregnancy and their baby. Then exercise, okay? Even you're pregnant, okay, you can exercise. You need to exercise, okay? So your blood circulation will be okay, will be normal, because there are so many cardiovascular problems that might happen during pregnancy. So to prevent this to happen, you need to do exercise, okay? One exercise that you can teach to your patients, pregnant mothers, is doing a brisk walking. Doing brisk walking, okay? Brisk walking, it will decrease the edema or the swelling of the legs, okay, that is normally being seen during pregnancy, okay? Or exercise plantar flexion, dorsiflexion, plantar flexion. So that's a simple exercise you can teach to your patients. Then we are also educating about prevention of complications. Prevention of complications like diabetes, okay, then hypertension, nausea and vomiting, and this stuff. So we need to educate them. Then meeting the pregnant woman's physical needs. First, before pregnancy, as nursing assistant, can record the you can record the you can record the vital signs. You're the one who will be recording the vital signs. So the doctor will have a baseline on the baseline data about your patients, about the patients. Then you can also obtain urine samples that needs to be collected. These are usually collected, especially if the pregnant mother is diabetic. Okay. Then, helping with personal care. Helping with personal care, especially hygiene. Okay? Helping with personal care. Next one is helping them with personal care, especially as I've told you, you need to help them in their perineal care and hygienic uh, needs. So you need to assist them. Then meeting the pregnant woman's emotional needs. So uh, pregnant women can have this mental problem or psychological problem like postpartum blues or postpartum anxiety. Okay, these are the things, the postpartum depression. So as nursing assistant, if you saw a patient who has this depression, okay, you need to inform the nurse and then or the doctor that is having like this, because maybe in the long run, during after giving birth, he can have this problem. Okay, the worst that it can happen, the patient uh, might kill the baby or might kill herself. So if you notice this attitude or depression to your patient, you should inform immediately. Then labor. Labor and delivery is the process wherein there is contractions of uterus which squeeze the baby downward, forcing his head against the cervix so that it opens or dilates. Okay, so delivery is the process of giving birth. Then it can be vagina or it can be cesarean. Okay, when it's via vaginal, of course the baby will go out via vaginal tract. Then if it's cesarean, okay, the doctor will cut the abdominal area, okay, to deliver the baby. Incision made in the mothers in the abdomen, so this is cesarean. So what are the things that you need to do during postpartum? So this is aftercare. Labor and delivery during delivery, and postpartum care is during after delivery. So common defined as the 6 weeks after childbirth. Okay, for example, you delivered today, so you will count after 6 weeks, it will be postpartum care. So what are the things that you need to do as nursing assistant? First one, taking vital signs. Okay, especially if the mother is hypertensive, he can have continuous hypertension uh, because of the delivery. So you need to monitor the vital signs. Then assist with transferring and walking. Okay. Then assist with toileting. It's very painful. If you're having vaginal delivery, okay, it's very painful. So you need to assist with toileting. Observing. Okay, how you'll observe the patient. Observing is if your patient is verbalizing that I have too much discharge after delivery, okay? I'm soaking 3 packs of napkins or 5 packs of napkins for 1 day or 2 days. You need to inform the doctor because the patient is having bleeding, severe bleeding, and it can be life-threatening to the patient. So managing vaginal discharge, you need to know what are the discharges that is expected, that the mother is expected to have. First, uh, how you will remember it is RSA. RSA. The first discharge that you'll see is rubra. Rubra, the color is bright red. So it's normal. For example, 1 to 3 days, the discharge is bright red. It's rubra and it's normal. When you saw rubra during 10 to 15 days after delivery, it's abnormal. Okay? Because the discharge that you need or expected to be seen is alba, and it should be creamy to yellow in color. So that's why we are studying this one. Then serosa is pink or brown tinge color. Then alba is follows for another week or two, is mostly creamy white to yellowish in color. Okay. Then assisting with perineal care. Okay, why you are assisting perineal care? As of the study, they are perineal care can help the patient, especially vaginal delivery, okay, to heal their episiotomy. Episiotomy is the incision of the perineum, okay, to make it more big so the baby can come out in the vagina. Episiotomy is uh what's this? uh, fixing the lacerated lacerated perineal area. So they are putting suturing it. So that is a fissura P. To make it heal easily, okay, they are giving perineal care like sitz bath. Okay, sitz bath, how you will do this as nursing assistant, okay, you need to get a warm water, then allow your patient, okay, to sit near the warm water and then stay there for about 5 to 10 minutes. Okay, it will heal and it will also ease the pain and the tension in uh, the incision site. Okay, so that's how you will do sits, but don't allow the patient to sit directly to the water because it can cause burn. But it needs to sit near to the sits bath. Okay, you need to assist also the mother with breastfeeding, especially those first time mothers. First time mothers, they don't know how to breastfeed. Okay, they don't know how to breastfeed, so you need to assist them. You need to instruct them that the baby should latch on their nipples. Okay, the the areola should be covered or should be sucked totally by the children or by the baby. If it's not sucked, it's not an effective breastfeeding. Okay, so it needs to be instructed to the mother. Okay, if they are feeling mastitis, okay, mastitis, or they are having fever because of severe swelling of the breast, because you will feel it after delivery. Okay, what needs to do is to put warm compress to the site and then you massage it, and then the milk will come out. Okay, so that's your instruction. Breastfeeding is very important. You need to instruct them that you need to breastfeed your child, okay, not to bottle feed your child, because breastfeeding your child will give them, the baby, the first line of defense, the antibodies that is needed for to fight infection, which is called colostrum. Okay, colostrum is the content of the breast milk. Okay, then caring for the baby. Okay, caring for the baby. Okay, so you have already the baby delivered. Okay, what are the things that you need to do for the baby? First is you take your vital signs. Okay, usually the baby, they are using uh what's this, before they are using the rectal temp in getting the temperature, but now they are using the tympanic or the forehead thermometer. Then ensuring security, okay, caring for umbilical cord. Usually 7 to 10 days, the umbilical cord will falls fall out. So it will be dry. Okay, don't put anything on the umbilical cord, just allow it to dry. Don't put any cloth or anything like the superstitious belief before. It's not it don't it's it doesn't have a scientific basis. So just make it open, okay, because putting a cloth on the umbilical cord will make it moist and the infection will come in. Then providing circumcision care, okay, if your patient is a Jew or the patient is Muslim, they are circumcising the patient immediately after birth. Okay, so you need to give them a circumcisional care. So circumcisional care to prevent infections. Then feeding. Okay, feeding, you need to give them, of course, breastfeeding, breast milk, okay, for their antibodies, for their immunity. Then diaper change. You need to change the diaper once it's wet. okay, with urine, and one it's soiled with stool, okay, you need to change it. If your patient have diaper rash, just put a cream, like just put a uh, petroleum jelly, okay, don't put anything like, what's this, powder, okay, powder can be can attract yeast infection. Then bathing, okay, giving them baby bath will provide a bonding between you and the baby, so, and it will prevent also infection for the baby, and you can assess any skin problems during bathing, okay. Always remember, if you're doing bathing for the baby, don't leave the patient unattended, because the patient might roll down and then fall, okay. So you need to be careful when you're handling babies. Then, and also you need to remember, when you're giving birth to the baby, always remember that they are at risk of hypothermia. Hypothermia is low temperature, so you need to uh, dry them always, so to prevent uh, loss of heat, okay, from their body. And you need to always uh what's this, you need to always cover them, because they have a risk of hypothermia. Then putting the baby down to sleep, okay, one of the reason that the baby or the infant mortality, okay, all over the world, it's called SIDS, sudden infant death syndrome, okay. Sudden infant death syndrome, it's like the baby will sleep, and then after that he or she will not wake up, because he or she died already. Why? Because you put the baby in a wrong way, okay. You put the baby in a wrong position, okay. If you're positioning the patient, okay, for sleeping, make sure that there's no stuff around the baby, because the pillow can cover the, or can cover the mouth or nose of the patient, and there will be oxygen deprivation. So you need to clear this out, okay. And then you position your baby into supine position, okay. You need to put him or her into supine. Don't put him in prone or side lying, just put him supine position. This is the best position that the patient can have to prevent sudden infant death syndrome. Then, transporting the baby, of course, you need to be gentle in transporting and very careful in transporting the baby. Okay, how you will hold the baby, you need to hold her or him into cradle hold. Cradle hold is like this. Okay, the head is elevated than the body. Then, new foods, caring for infants. New foods are introduced one at a time to determine the food responsible if the infant has reaction. Okay, how many days you need to experiment this kind of food to your patient? For example, 1 to 3 days, you need to give her carrots. Next, 4 to 6 days, you need to give him potato. So don't give him carrots, potato, then banana. So don't give him like that. So you should give him uh, same food for a certain period to know if the patient have a reaction to the food. Maybe he have allergy to carrots. Okay, we don't know. Okay, if you're giving only 1 day, every 1 day you're changing uh the food, okay, you will not know that he's having reaction, because some reactions or allergies, it will develop, okay, late. So you need to introduce food in a certain period. So 3 to 5 days carrots, or 3 to 5 days potato, 3 to 5 days banana. Okay, so it's like that. So next is, an infant can be gradually weaned to a cup as her or desire for sucking decreases. Okay, so that's the time that you can wean the baby. Okay, if sucking decreases. Okay, then bottle mouth caries can occur when an infant is given bottle at bedtime. The sugar from the formula causes erosion of the tooth enamel. Okay, so sugar can develop dental caries. To prevent bottle mouth caries, a bottle of plain water or pacifier for sucking can be given at bedtime. So you need to introduce also water, or give water after bottle feeding. So to prevent dental caries, or pacifier can give. Then if an infant resists drinking milk from a cough, calcium and vitamin D needs can be met by giving foods such as yogurt, custard, and cottage cheese. Then children are immunized. You need to give immunization. Okay, the right immunization for your baby to prevent any infections. Okay, major infections that can infect your baby. So you need to have hepatitis B, diphtheria, tetanus pertussis, that's DPT, rotavirus, Haemophilus influenzae, okay, Hep B, uh, hepatitis virus, Haemophilus influenzae type B, polio, OPV, that is OPV, measles, MMR, that's measles, mumps, rubella, varicella, chickenpox, pneumococcal disease, meningococcal disease. So these are the basic immunizations that the baby should have. Okay. And additional, you can give also hepatitis A. Immunizations are begun shortly after birth. What are those immunizations given after birth? Just immediately after birth, they are giving BCG to the patient. Okay, BCG and hepatitis. The first dose of hepatitis B vaccine. Okay, the other, they are giving it around 3 to 6 months or 9 months. They are giving the immunization. Then during routine health maintenance visit, caregivers are given teaching regarding normal growth and development. So I told you about normal growth. I taught you about normal growth and development of an infant. Then infant's gums and teeth should be clean with a clean. Okay, how you will be clean? Don't use toothbrush because still it's very soft. The teeth and the gums are very soft, and so it might bleed. So you need to use a clean damp cloth and plain water to clean the oral cavity of the patient. Then accident prevention, you need to monitor the patient. Now the patient uh, can crawl, the patient can stand, the patient can walk, so he can have accident. So you need to watch them closely. And an infant when an infant is hospitalized, the family caregiver can give the child stimulation and care and attention by feeding, holding, and diapering. Okay, so now we'll go with the toddler. Toddler tries to assert his or her independence. Okay, is curious about the world. Okay, we all know toddlers are having temper tantrums. So you remember T for toddler, for T, temper tantrums. Okay, so this time they are not cute anymore. They are very naughty. They are very hard-headed. So these are the toddlers. So there are times that they have this separation anxiety. Then, because of toddlers' newfound independence, parenting can be trusting a challenge. Then, a toddler's physical growth slows while motor, social, and language development rapidly increase. Okay, they are always saying no, no, no. This is for toddlers. Okay, using negativism, the toddler often says no to almost everything. Okay, to develop security, the toddler likes to follow specific sets of routines. You remembered, according to one theory, that toddler is autonomy versus shame and doubt. Okay, autonomy, it means that the patient wants to decide for themselves. That's why they are saying no, no, no. Then ritualism. Okay, what is ritualism? Ritualism is like if they are having pillows that they are holding while sleeping, okay, they need to hold it every day, every time that they will sleep. Okay, if you remove it, they will not fall asleep. Okay, so that is ritualism. Or maybe they want to have books to be read to them, okay, before sleeping every day like this. So that is ritualism. Valling occurs when toddlers follow their own desires rather than caregivers' wishes. So I told you temper tantrums, for toddler. Temper tantrums are an aggressive display of temper in which the child reacts with rebellion to the wishes of caregiver. If you told, I don't want this, I don't want to eat vegetable, I want hot dogs. Okay, how you will manage to deal with this kind of situation. Okay, don't spoil the toddler because later on you will be in trouble. So what you will answer if they are telling always no, no, no. Okay, what you will do is you limit your options. Okay, no options given, so they will not answer you no, yes or no. Okay, so you limit your options. So that's the thing that you need to do. Then eating problems occur in toddler. They are so picky. Okay, they want food jugs. Then the toddler progresses from finger feeding and tilting the cup to being able to hold the spoon. Bacteria forms dental plaque on the teeth. That's why oral care is very, very important. As early as 2 years old, you can bring your toddler to the uh, dentist, okay, to check their teeth. Toddlers, they want to imitate others because they want to imitate others. Also wants to imitate others. That's why you can teach them, okay, you can do brushing and then they will follow you. The toddler should visit the dentist ayan, about age of 2. Toilet training, very important because they are psychosexual theory of Freud. They are in anal stage. So this is the right time to train them in toilet. Okay, can be started. Toilet training can be started, usually occurs 18 to 24 months. So if you're very strict during toilet training, there it will have psychological problem to your toddler. Okay, and if you're so lenient with your toilet training, it will also affect the personality. The leading causes of death in toddlers are accidents like motor vehicle, drowning, burns, poisons, and falls. So you should supervise and watch out, care, or monitor them. Okay, because they are so naughty. Uh, they can drink whatever they are holding, like the medicines. The medicine should be not reached by the toddler, okay, to prevent this accidents to happen. Then toddler should always be secured in a car seat when in a motor vehicle. Supervision is important when toddlers are near motor vehicles. Then the most common medications involved in child poisoning are acetaminophen. So this is for fever, aspirin, laxatives. Okay, but if you are neglecting your toddler, they can take this and then it will be a problem. Then caring for preschool, according to Erickson, the development of this patient or this age is initiative versus guilt. Okay, So this is the best time to instill discipline. During the preschool years, psychosocial growth is substantial, but physical growth slows. By the age of 6, children usually have achieved 20/20 vision. Then language develops rapidly during preschool, progressing from ability to use simple sentences at age 3 to telling sometimes long and involved stories by age 5. Then language development may be delayed because of hearing impairment or physical problems, lack of stimulation. So sometimes you're seeing your baby is already preschool but is only telling mama papa. Okay, yes, yes, language delay. Okay, why? It is affected by so many factors, like maybe you're so busy uh you're not teaching your child, or your baby is in the surrounding that is not suitable for him, so that will affect the development of the language. Magical thinking. Magical thinkers. Remember that preschool children are magical thinkers, okay? Sometimes they are thinking that they have playmates who is a superhero. They have playmates who is a fairy, okay? So it's normal for them, okay? So, but if you're already adult and you're seeing something, it's not normal. So magical thinking is only normal for those preschool children. Then preschoolers, they are sexually curious, okay? And exploration of her or his genitalia is normal, okay? It's phallic stage, okay? Remember the psychosexual stage of preschool is, which is phallic. They are sexually curious. It's normal to them, okay? A calm understanding caregiver can help the child before develop positive attitudes about himself as a sexual being, okay? It's normal. Dramatic play allows for acting out troubled situations. What are those? If your patient is admitted, or preschool children is admitted to the hospital, okay, and you want to give him an injection, okay, how you'll do this? Okay, first is you need to have demonstration. You need to put a toy injection to you, and you'll tell, oh, it's not painful, so you do it also, okay. In that way, the patient or the preschool will be will decrease the anxiety. Then preschool may show verbal aggression by name calling and physical aggression by pushing or hitting. Usually during preschool, if you're a mother of a preschooler, you're being called by the principal or the teacher that your baby or your preschooler, okay, kick someone. Okay, so it's normal for them, but make sure that you uh, told them what are the right things to, or discipline them. What are the right things to do, and what are the things that they need to avoid. Then the disadvantaged child who has not been able to develop a sense of trust needs understanding. Then, even though preschool child has a decreased and erratic appetite, adequate protein nutritious snack, and avoidance of food, so they are also picky eaters. So as a caregiver or nursing assistant, you need to reinforce them. You need to also ins- uh, instruct about the immunizations that they need to have, and seatbelt is also important while on uh, the car, bicycle safety helmets, then prevention of accidents. You can also teach them how to wash their hands, their mouth, brush their teeth. Okay, because this time they have the initiative, so you can start to teach them. Then next is caring for school age. According to Erickson, the developmental task of school age children are industry versus inferiority. You remember your child when are believing more. They are believing their teachers more than you. Why? Because they are very fond. They are very attached to the school more than you. So because they are industrious, they are not industrious, they'll feel inferiority. They will feel lower than the others. So what are the things that we need to instruct them? So they are fond of cooperative play. They want to play with the same sex. For example, male to female and female. They are having uh, they are playing with each other, and then for boys, they are also playing with each other. So this is the type of play that is cooperative play. By allowing expression of foods and likes and dislikes by setting good examples, caregivers can help the school age children develop more nutritional habits. Especially they're going to school, they need more nutritional requirement. Then obesity in the school age children can be it's you can see many obese students in the school. Why? Because of nutritional intake. It can be genetic or environmental, or it's sedentary lifestyle. So you need to instruct them that you need to have exert physical activity, limit fat intake, and positive caregiver support. Well-balanced diet should be there also. And they need to sleep 10 to 12 hours of sleep each night. 10 to 12 hours of sleep each night. Sexual education is a very crucial things to teach them, because in other countries it's immoral issues. So, but mostly they are teaching now sexual education to prevent uh, premarital sex and early pregnancy. Okay, so if you're educating the as early as school age children, okay, in a right terms, in a right, not so complicated, okay, based on only their thinking. So this is the situation, like early pregnancy will be prevented. Then substance abuse is in an ever increasing concern, because this time they are having peer pressure. They can have cigarette, they can have alcohol already, because the parents are not always there to see them. So as a caregiver, you should be watchful, okay, because you can see if you're if the child have no interest in the school, he wants only with the peers, okay, you should report them to the uh, concerned people. Then safety issues. Now they are have gross motor skills like motorcycling, bicycle riding, skateboarding. So they are so much risk. They have so much risk for accident. So you need to uh, instruct the safety measures. Then children's interest in science creates a fascination with bodies and how they work. The change in school age children's understanding of birth, death, and human death and illness influence the child's view of his or her own health. Then, caring for adolescents during the pre-adolescent years. So, next is caring for adolescents. Adolescents ages, what are the age of adolescent? It will be 12 to 18 years old. During this stage, there are so many physical and mental emotional changes. Okay, the for female and male. The female, they are having enlargement of the breast, they are having menstruation, the enlargement or broadening of the pelvis, and etc. While the female, they have enlargement of the penis, and then broadening of the uh, back, the muscles, pubic hair. So these are the physical changes that they are having. So as a caregiver, we need to support and give them right education so they can uh, cope with this kind of situation. The rapid growth of skeletal system outspaces the growth of muscular system. Then secondary sexual characteristic or the physical changes it will be happening. Then according to Piaget, the adolescent moves from concrete operational thinking to formal operational thought. It means that the patient or the adolescent is having abstract thinking already. He can think about what will happen in the future, what will be, what will I do, because the future can bring like this. So this is abstract thinking. Then changing sexual role stereotypes, geographic mobility, abundant career opportunities and options. They are so competitive at this stage, okay? And they are having crushes, they are loving opposite sex. So intimate relationships. So as a parent or caregiver, we need to guide them. In trying to develop their own sense of self and identity, adolescents begin the process of separating from family. Okay, they wanted more time for their peers, for their uh, friends compared to the parents or the family. Then sometimes there is problem with body image and self-esteem. Okay, so that you need to give them support. Then adolescent diets are often deficient in calcium, iron, zinc, vitamin A, D, and B6 and folic acids because of the menstruation. Because of the menstruation, the patient is, or the adolescent, especially the female, is losing their iron. So you need to instruct them to eat foods rich in these nutrients. Then health education and sexual education is very important to prevent diseases like STIs or sexually transmitted infections and early conception. Also, you need to teach them to prevent substance abuse, alcohol abuse, drug abuse. During adolescent, they are so particular with privacy. Okay, if you have patient which is adolescent, they wanted to be alone, they are so private people, so you need to respect this kind of stuff because they are adolescent. So what is child abuse? Child abuse is when a parent or a caregiver, whether through action or failing to act, causes injury, death, emotional harm, or risk of serious harm to a child. We have different types of abuse. We have the physical, of course, you're giving physical neglect or deliberate injury, psychological, or it's an emotional thing, sexual, okay, an adult touches a child inappropriately or forces the child to perform sexual acts. So what are the signs? Okay, sometimes you'll find a patient or a child, okay, that you will see signs and symptoms that this child is being abused. So first, signs and symptoms: unclean or unsafe living condition, poor personal hygiene, because if he or she is having parents who is taking care of him, its hygienic care is not poor. Then there is a skin irritation, uncombed hair, unclean body, urine soaked undergarments, then loss of weight or dehydration, multiple or unexplained fractures. Okay, so these are usually This is the usually signs and symptoms that we are seeing in the child abuse. Unexplained fracture or bruises. Okay. Then burn marks, scalds. Then abrasions from the ropes or other binding patches. Vaginal bleeding or discharge. Excessive sexual curiosity or play. Anxious, fearful, or withdrawn. Okay, actually, for child abuse patient, he or she is not talking with you. It's very depressed, very withdrawn with the environment. Okay? Uncontrolled medical conditions, history of requiring health care for similar injuries. Then, okay, so these are the signs and symptoms of a child abuse patient. So this is how we take care of the mother and the child. Thank you.